as far as the plague is concerned, this is the first element or the first parallel in answer to your question between the time when the book was conceived and written and the current context, the beginning of the COVID-19 pandemic. So there are several parallels, and I'm going to mention a few. So first of all, both the Black Plague and COVID had their origin in what is modern China. Of course, that at that time in the medieval times in the 14th century, when Boccaccio wrote this book, China as a national entity did not exist. So let's say Eurasia, the center Eurasia was the place where this pathogen of the Black Plague, Yersinia pestis was the Latin name, originated. And the second parallel is not only this origin in Central Asia, in what is modern China, but also the fact that the pathogen jumped from an animal to a human. And of course, for Yersinia pestis, the pathogen was carried by fleas nesting on rats that traveled along merchant routes in what was the early age of the globalization. So yet another parallel, if you wish. So on a different level, on a social level, I would say, a striking parallel is the ethical dilemma than the 10 young Florentines imagined by Boccaccio face in their decision to temporarily abandon Florence, the city, and retreat to the countryside in the middle of the plague, reproducing to some extent the current conditions of lockdown and stay home. We will see more in detail later. Speaking of which, as a slightly weirder side effect, I was recently interviewed by a trendy magazine for an article whose title somewhat synthesizes what is perhaps the most frivolous aspect of this renewed interest in Boccaccio's book. The title goes, "Decameron and Chill, Why a 14th Century Italian Masterpiece is on Everyone's Coronavirus Reading List," with a reference to the meme Coronavirus and Chill that suggests a supposed increase of romantic activity because people are cooped up together. Well, as we shall see, there is indeed a parallel to be drawn to the erotic theme of many stories in the Decameron, although it is not exactly what this journalist had in mind. It is the parallel between the plague and love sickness, perhaps less evident with COVID than it was at the time of HIV/AIDS, another time when the Decameron became a bestseller. In fact, a prominent Italian writer who also happened to be gay, Aldo Busi, rewrote the Decameron at that time from a non-binary perspective. The idea that in the Decameron, the real pandemic is related to the consequences of love is both disturbing and illuminating. After all, love is the ultimate form of proximity, of togetherness, and as a social bond, as a passion. It is the ambivalent binding agent of social trust, sorely tested as we speak in our pandemic.